lot of women that are getting breast implants are really, really thin, so that's why they're getting them.
Yeah.
So if they're really thin, there's just no way to put them above the muscle. But it's definitely moving in the trend of going above the muscle.
Okay. So what's the difference? I saw you said something about like smooth, rough, and then how you can like shape them.
Shaped implants. I can't shape them.
No.
But they come out of the box shaped as opposed to a round implant. It's a teardrop shape, so it has a more natural silhouette. It looks like what a breast should look like. So those are textured and they're anatomical shaped, and those are primarily what I use for reconstruction. And if I look at a patient and if I'm relying on the implant for volume, just volume, I can go with a round implant. If I'm relying on it for volume and shape, then I go with an anatomical shaped implant.
Okay. And something. Okay, so it said you can't smoke before.
You should never smoke.
I know. What's the medical reason?
So we think that smoking interferes with wound healing. Right? Doctors, we're bad people. I tell my dad to stop smoking every day. He smokes a pipe. I tell him every day to stop smoking. And he's like, show me the data that says a pipe's going to make me have health problems. But nicotine and it's probably the tar and the other stuff that are in cigarettes affects your ability to heal a wound.
Okay.
Right? And in something that I rely on vascularity, breast reductions, or tummy tucks, if you insult the body, like surgery's an insult, right? And you are relying on a blood supply, and then you introduce nicotine or what's in a cigarette, the vasoconstriction that happens can cause wound healing. Like basically not enough blood flow will get to whether it's the nipple for a breast reconstruction or whether it's the central area for a tummy tuck, and tissue will die because of not enough blood supply. So like noses and facelifts, I mean, my God, Kulak would literally die if she thought you were smoking before her facelift. Because if there's any vasoconstriction, you can lose like all of the skin, like all of this where your incision is along a facelift can die. It's devastating. And it happens. Yeah.
Okay.
Vascularity wound healing.
Also, what's this? Is that on your website?
Capsular, that's that hardening of the implants.
Okay.
So that's that.
Okay.
We didn't know why it was. It happened a lot early on. A lot of women just accepted it. They'd come into the office with capsular contracture 20 years ago, and the surgeon would be like, all right, I'll just pop it. And they would press on them so hard that it would break up that scar tissue. Probably like puncture, break the implant too. Knuckleheads. I don't know what they were thinking. But now we just know it's capsular contracture. The scar tissue around an implant's getting hard for